This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
We're approaching the holiday that focuses on celebrating the one who gives you the butterflies, the one you can't live without, the one who has your heart.
Has your heart. Fitting, because it's also the middle of the month where we focus on making sure that heart of yours is in tip-top shape. As we continue educating you through Heart Health Month, we'd like to introduce you this afternoon to Dr. Zachary Baker. He's a cardiothoracic surgeon at Peninsula Regional Medical Center. Thank you so much for joining us.
Thank you for having me.
So we're talking about open heart surgery, the program at PRMC. You are really meeting a need there, aren't you?
Yeah, most certainly. Being one of the, well, really the major center in this region for open heart surgery. We have the longest history of the region. So yeah, it definitely feels a big need.
So, we also want to talk a little bit about vascular surgery in general. I hate to use the word ideal candidate, but who's a candidate for it?
For cardiac surgery or vascular surgery. So
yes.
there's they're kind of separate subspecialties nowadays.
Oh, okay.
So in terms of the heart, cardiac surgery, I think has changed in the last decade or two with the advent of stenting. So you probably hear a lot of times now patients who come in, they have a heart attack and maybe they get a stent placed. In the olden days, well, I'll say olden days, 2 decades ago, that would be, a lot of the times that patient would even go for open heart surgery, for a bypass surgery. So it's become a lot more selective, and the indications for example, a heart bypass surgery are a little more strict than they used to be because of the advent of stents, which kind of leads to us as the cardiac surgeons doing a little more complicated cases. So multi-vessel disease or multiple coronary vessels that are affected, then we have to go in and do 4 or 5 bypasses to them as opposed to a stent being put in.
So big picture, overall, your heart health and your need to take care of it is really important, isn't it?
It is, most certainly. I always say if your heart's happy, you're happy.
Okay.
And if your heart's not happy, then your whole body struggles.
And we just learned last week that, there's no real point of no return. I mean, anybody can start their heart health.
Most certainly, most certainly. Genetics play a huge part in heart disease. That's the one factor, risk factor, that unfortunately we have no control over. And so because of that, people with high cholesterol in their family, that runs in their family, be active or proactive about it, even in your, starting in your 30s. Go to your family physician, your primary care physician, and get your cholesterol checked. And again, you may end up being one of those unlucky people who has a family history of it, who ends up needing, even medical therapy or medications that early in life. So a lot of people don't associate heart disease with your 30s or 40s, but unfortunately we see it. We see people with heart attacks in their 30s. It's not as common, but we do see it. We definitely see it in the 40s.
Well, Dr. Baker, as you've already mentioned, things have changed a lot over the last couple of decades. There's actually an open house that you can attend on Wednesday to find out more. Peninsula Regional Medical Center has their open house from 3 to 5 this Wednesday, this week. That would be tomorrow. It's going to be at the Ocean Pines Health Pavilion, just outside the North Gate. It's free to everybody. It's open to you as the community, whatever age. Please come on by. Learn the answers to the questions that we're talking to Dr. Baker about this afternoon. Thank you so much
You're welcome.
for sharing this information with us this afternoon.
Thanks for being here.